Hey there, fellow cat lovers. Are you ever worried about those unaffected scratches and nicks your feline friend seems to find? Well, you're not alone. Today, we're diving into the world of cat care, specifically, how to safely treat cat wounds at home. So, grab a cup of your favorite beverage, and let's get started. Understanding cat wounds. First things first, understanding cat wounds. Cats are curious creatures, aren't they? They climb, jump, and sometimes, they end up with a scratch or two. It's important to know when a wound is minor enough for home care and when it's a vet visit alert. But how do you tell the difference? Well, it's all about the size, depth, and how your cat reacts to it. A small, superficial scratch? Probably fine for home care. But if your cat is continuously licking it or it looks deep, that's your cue to consult the vet. Also, consider the location of the wound. Is it in a spot that's difficult for your cat to reach and keep clean? If so, that might increase the risk of infection. 1. Cleaning the wound. Alright, technique number 1. Cleaning the wound. Imagine your cat just came home with a small scratch. What do you do? First, gently clean the area with mild soap and warm water. Remember, be gentle. We don't want to upset our little adventurers. And here's a pro tip. If your cat is a bit skittish, try wrapping them in a towel to keep them calm and secure. This kitty burrito method can be a game changer. Make sure to dry the area thoroughly after cleaning, as moisture can be a breeding ground for bacteria. 2. Applying antiseptic. Moving on to technique 2, applying antiseptic. After cleaning, it's time for some antiseptic. Choose a cat-friendly option, please. Apply it carefully on the wound. This step is like saying, hey bacteria, not today. But be mindful of the amount you use. Too much can irritate the skin, and we don't want that. Also, avoid using human products like hydrogen peroxide or alcohol, as these can be too harsh for your cat's delicate skin. 3. Bandaging, if necessary. Net up, technique 3, bandaging. This one's tricky, folks. Cats usually don't like bandages. But if needed, use a light, breathable bandage. Make it snug, but not too tight. We're aiming for comfort, not a cat mummy. And keep an eye on the bandage. If your cat is trying to bite or remove it, it might be uncomfortable. In that case, reassess and adjust as needed. Regularly changing the bandage and checking the wound underneath is also important to ensure proper healing. When selecting a bandage, opt for materials that are specifically designed for pet use. These are usually more pliable and less likely to stick to fur, making them more comfortable for your cat. Avoid using adhesive bandages that are meant for humans, as they can irritate your cat's skin and be difficult to remove. Applying the bandage is an art in itself. If you're not experienced, it might be a good idea to ask your vet for a quick demonstration. The key is to cover the wound adequately while allowing some air circulation. The bandage should be firm enough to stay in place but not so tight that it cuts off circulation. You should be able to fit 2 fingers snugly under the bandage. Monitoring the bandage is crucial. Check it at least twice a day for signs of slippage, tightness, or soiling. If the bandage gets wet or dirty, it needs to be changed immediately. Wet or dirty bandages can lead to infections and slow down the healing process. Also, pay attention to your cat's behavior. If they seem excessively bothered by the bandage, it might be too tight or causing discomfort in some other way. Some cats may need a bit of time to get used to the feeling of a bandage, but if they're persistently distressed, it's worth re-evaluating the situation. Remember, the goal of bandaging is to protect the wound and promote healing. If at any point you feel unsure about how to properly bandage the wound, or if the wound seems to be getting worse despite bandaging, contact your vet. They can provide guidance or suggest alternative solutions. So, there you have it, folks. Bandaging can be a helpful technique in treating cat wounds at home, but it requires careful application and monitoring. Always prioritize your cat's comfort and safety, and when in doubt, seek professional advice. 4. Monitoring the wound. Now, let's focus on technique number 4, monitoring the wound. This step is super crucial, folks. It's all about being vigilant and knowing what to look for. So, let's put on our detective hats and get to it. First up, keep a close eye on the wound daily. What you're looking for are signs of healing or, unfortunately, signs of infection. Healthy healing involves the wound gradually closing up and less noticeable redness and swelling. But here's where you need to be a bit more alert. Watch out for red flags like increased redness, swelling, or the wound feeling hot to the touch. And, if you see any pus or discharge, that's a big no-no. These are telltale signs of infection. Also, monitor your cat's behavior. Are they more lethargic than usual? Do they seem to be in pain or discomfort? These subtle changes can speak volumes about their recovery. In addition to these signs, pay attention to the color and condition of the wound itself. A healthy wound should start to look cleaner and less inflamed as days go by. If the wound appears to be getting larger, more inflamed, or developing irregular edges, these could be signs that it's not healing properly. Another aspect to consider is your cat's appetite and overall demeanor. A decrease in appetite or a lack of interest in activities they usually enjoy can be indirect signs of discomfort or pain related to the wound. Cats are masters at hiding pain, so these subtle behavioral changes are important clues. Remember, you're not alone in this. If you're ever unsure or if something seems off, don't hesitate to reach out to your vet. It's always better to be safe than sorry. Your vet can provide guidance or ask you to come in for a checkup. They might suggest additional treatments or changes in care based on the wound's progress. So, keep those eyes peeled and stay attentive. Your furry friend's speedy recovery might just depend on your keen observation skills. And remember, a little extra TLC during this time can make a world of difference. Regular gentle petting and calm, soothing conversations can help reassure your cat and promote a stress-free environment, which is conducive to healing. 5. Preventing licking and scratching. And now, let's talk about our final technique, number 5, preventing licking and scratching. We all know how much cats love to groom themselves. It's part of their charm, right? But when it comes to wounds, this adorable habit can be a bit of a problem. Licking or scratching a wound can slow down healing and even lead to infection. So, what can we do? Firstly, distraction is key. Engage your cat with their favorite toys or introduce new ones. This not only keeps their mind off the wound but also strengthens your bond. Who knew wound care could be a bonding experience? Try interactive toys like laser pointers or feather wands that can keep them engaged and active, diverting their attention away from the wound. But sometimes, toys just don't cut it. That's when the infamous pet cone comes into play. Yes, the cone of shame, as some call it. But, let's rebrand it as the cone of healing, shall we? It might look funny, and your cat might give you the cold shoulder for a bit, but it's super effective in preventing them from reaching their wound. Remember, the cone should fit comfortably. Too tight, and it's a no-go. Too loose, and well, your clever kitty will have it off in no time. Adjust it so it's just right. Think of it as a temporary crown for your brave little soldier. And here's a pro tip. Some cats really don't like the cone. If that's the case, look into alternative options like soft collars or protective clothing designed for cats. They're less intrusive but still do the job. In addition to these physical barriers, consider the environment around your cat.